Honorable Excellencies, distinguished guests, respected colleagues, and members in the audience. I'm Meghna Badami, RASIT's Youth Representative to the UN, member of the Girls in Science for SDGs International Platform, and a fourth-year medical student from India. The topic of this panel is one close to my heart, and as a medical student in a government-run hospital, especially a low-middle-income country, it's certainly one that we touch base with every day. Before I get into the nitty-gritty of my statement today, I'd like to share an incident from 2 weeks ago. I was posted in internal medicine as a part of my clinical rotations when a patient with a bizarre array of neurological symptoms presented. And as most medical students with an eye for the uncommon, we flocked to examine. I won't get into the medical specifics, but her condition puzzled even our senior doctors. Of course, the best attempt at a diagnosis was a brain scan. However, even with the maximum possible subsidization and economic aid, they couldn't afford it. We talked about patients being unable to afford treatment, but looking at someone who couldn't afford a simple MRI scan, it was heartbreaking. It isn't just this one, but thousands and hundreds of such stories that flow through hospital doors, and very few of them are actually brought to justice. Most of them are lost and buried under bureaucracy and equities, especially in the underdeveloping and developing world. Hence, it's baffling that the statement, healthcare is a human right and dignity, ought to even be explained further. The issue lies not in the area of scientific or medical advancement, but in the apt utilization of this knowledge and these resources. Even in the same city, the disparity between medical care between the rich and the poor is shocking. Resources in terms of healthcare providers, laboratories, medical equipment, and infrastructure are not that dire when you look at it as a whole, but extremely unevenly distributed. And it's this gap that we need to bridge. With intergovernmental understanding and international health policies, this can very well be a possibility in the near future. It's the need of the hour to be selfless with our resources, foreseeing with our ideas, collaborative with our efforts, and global with our solutions. We're up against more than just economic, but socio-cultural and political influences too. And that is a fight that no government and no organization can fight in isolation. The most promising solution would be one which utilizes the strength in our numbers. $1 from 1 million individual persons would still add up to $1 million. In fact, it is this simple philosophy that's being put into use in the Yashaswini scheme, a health insurance for farmers in the state of Karnataka here in India. Furthermore, events of the recent past have only made us realize that even healthcare systems that were previously thought to be perfect aren't as resilient as we think they are. They can't sustain increased loads or take care of unprecedented calamities. War and pandemics have deepened our cracks and exposed our crevices. Appropriate management systems, not only within a country's primary through tertiary healthcare, but even within individual hospitals, can help with this. Lastly, in this fight for better healthcare, we absolutely cannot leave behind those who are most marginalized: tribal and secluded populations, the disabled, and women and children, to name a few. They are most affected by disease as well as the lack of treatment for it. We ought to seek special places for such communities in our policies and planning. Awareness is another equally important aspect, and this awareness comes in three folds. One is awareness amongst doctors and those who are in the medical fraternity themselves. Two, in youth who will further such efforts in the coming years. And finally, in the disadvantaged themselves, who need to realize their rights and demand for affordable, accessible, and safe healthcare. This is our call, the crucial golden hour. It's time we hold governmental agencies and policymakers responsible and urge them to take action towards a better tomorrow. A world where no man dies of complications of common illnesses, no woman is denied of reproductive care, No child succumbs to the cruel grasp of malnutrition and infection. A world where no one will die because of fake medicine, where everyone has the right to health and dignity. Such a world is not a distant dream but the right of all of humanity. And such a world is not a dream as long as we have people like Dr. Ismail Sukarriya. Dr. Ismail, we salute to you from India. You are the voice of humanity. Thank you.